Upper extremity patterns are used to address dysfunctions caused by neurological issues, muscular disorders, or joint restrictions. These patterns also help exercise the trunk, as resistance applied to strong arm muscles can stimulate weaker muscles elsewhere in the body. The choice of techniques depends on the patient's condition and treatment goals. The upper extremity moves in two main diagonals: flexion, abduction, external rotation with extension, adduction, internal rotation, and flexion adduction external rotation with extension abduction internal rotation. The shoulder and wrist hand complex work together, while the elbow can flex, extend, or remain still. Scapular motion is integral to each pattern. Proper positioning of both patient and therapist is crucial. The patient should be close to the table's edge, with head and neck supported. The therapist stands on the left side, aligned with the diagonal motion. Grips and body mechanics vary depending on the pattern and the need for control or resistance. Grips should follow manual contact procedures with the therapist's hands positioned to resist movement direction. Resistance is applied in an arc back toward the starting position. Traction is used at the beginning of motion and approximation at the end. Normal timing starts with hand and wrist movement, followed by the scapula, shoulder, and elbow. Stretch stimulus, with or without the stretch reflex, is used to facilitate movement. Repeated stretch during motion strengthens and guides movement. Strong arm patterns can cause irradiation, strengthening or mobilizing other body parts, relaxing muscle chains, or facilitating functional activities. This pattern involves posterior elevation of the scapula, flexion, abduction, and external rotation of the shoulder, with the elbow extended, forearm supinated, wrist in radial extension, fingers extended, and thumb abducted. Proper grip and body mechanics are essential for effective movement and resistance. In this variation, the elbow flexes as the shoulder and wrist move through the pattern. The therapist adjusts grips to provide appropriate resistance to both shoulder and elbow. Commands like hand up, lift your arm and bend your elbow help guide the patient. Here, the elbow extends as the shoulder and wrist move through the pattern. The therapist provides resistance to elbow extension and uses approximation at the end range to stabilize the shoulder and elbow. This pattern features anterior depression of the scapula, extension, adduction, and internal rotation of the shoulder, with the elbow extended, forearm pronated, wrist in ulnar flexion, fingers flexed, and thumb in opposition. Proper grip and resistance are essential for effective movement. In this variation, the elbow flexes as the shoulder and wrist move through the pattern. The therapist adjusts grips and provides resistance to both shoulder and elbow, ensuring proper movement and stabilization. This pattern involves anterior elevation of the scapula, flexion, adduction, and external rotation of the shoulder, with the elbow extended, forearm supinated, wrist in radial flexion, fingers flexed, and thumb in opposition. Proper grip and resistance are essential for effective movement. In this variation, the elbow flexes as the shoulder and wrist move through the pattern. The therapist provides resistance to both shoulder and elbow, ensuring smooth and coordinated movement. This pattern features posterior depression of the scapula, extension, abduction, and internal rotation of the shoulder, with the elbow extended, forearm pronated, wrist in ulnar extension, fingers extended, and thumb abducted. Proper grip and resistance are essential for effective movement. Certain combinations in upper extremity patterns, like thrust and withdrawal, involve fixed motion sequences. Thrust is associated with shoulder reduction and extension of fingers, wrist, and elbow, while withdrawal is linked to shoulder abduction and flexion of fingers, wrist, and elbow. These combinations can be used to emphasize selective motions or reinforce weaker muscles. Bilateral arm patterns use the strong arm to facilitate weaker movements in the involved arm. These patterns increase trunk muscle demand and can be performed in various positions for optimal strength and control. Exercising arm patterns in different positions, such as side lying, prone on elbows, sitting, quadruped, or kneeling, offers various advantages. These include allowing the patient to see the arm, altering gravity's effect, and practicing functional motions. Choose positions that maximize benefits and minimize drawbacks.